So let's talk about small vessel anatomy, just what you wanted in anatomy class. So in the brain, you guys have seen, you know, the circle of Weaver. Anybody heard of the circle of Willis? It's that normal anatomy that keeps our blood supply flowing. Small vessels are those real small perforating arteries, those little arteries. See those going down into the subcortex? They're the ones that feed into that little area. And how do they get their blood supply? Through those big vessels, those anterior carotid, or the carotid, the middle cerebral arteries. They get their supply from those big arteries. So when a small vessel blocks, this is good. See those little skinny ones that go up in there? If you throw a clot up into one of those, it's just a small area that's affected. You're still going to see some symptoms of the stroke, but they're small. And some people even have, these are the people that will have a stroke to that area, that they came in for something else, had a head CT, and then somebody will go, did you know you had a stroke in the past? Didn't even notice it because the area of the brain that was affected was so small. And these occur because they're way down deep. The problem is that sometimes it affects like the basal ganglia, the internal capsules, the pons. Those are some real significant areas of our brain that help relay tracts back and forth. So we can have a stroke and it may affect a nerve tract, which is why they can't move an arm, move a leg. So when you're assessing those, I mean, there's kind of 5 types. These are the ones that may just have a pure motor. They can't move an arm, they can't move a leg. Or it may just be pure sensory. Their arm's numb. That's the only thing they have, is that arm is totally numb. They may have ataxic if it's in that back part of the brain. Does everybody know what ataxia is? Basically that where they jerky movements, you know, when we do this. And then I also tell people ataxia is kind of hard, especially those people that have those posterior strokes that they're nauseated, they're dizzy, they can't see right. You know, how many people have that and it's not going to be a stroke? I always tell the kids when I'm teaching them in their orientation, you know, we do the nose finger up the leg and look for that. But sometimes those really small strokes that affect a significant area that may not even register on one of our stroke scales, I said when you bring them in and you sit them up and you're taking their clothes off, let go of them a minute. If they start doing this wobbly, can't hold themselves up, that's more of a truncal ataxia, and that tells me it's something more central, and they may truly be having a stroke. So these people with these small vessel diseases, it can happen suddenly, but more often it's just kind of a fluctuating, occurring, progressive presentation of symptoms. Small vessel diseases, that arrow's pointing at the stroke. Can you see that little dark area down there? That's how small a small vessel disease stroke will be. But 70 to 80% of these people will end up doing okay, and they're functionally independent at 1 year after the event. 97% of them will usually survive 30 days, and they have a 10% chance of reoccurrence.